Rahman Rahim. Today we will have a new rheumatology capsule titled F and F Fibromyalgia Facts and Fictions. Fibromyalgia Facts and Fictions. Actually, it was a longer lecture, but this is the abstract of the old lecture presented by me last year. Here we will have a game or similar to game. I will present to you a sentence and ask is it right or wrong. If it is right, it will recolored into green, and if wrong, it will be recolored into red. So first of all, this is the first sentence. This is the first question. Fibromyalgia is a pure neurological disorder. What is your opinion? Fibromyalgia is a pure neurological disorder. You can stop for, of course, the video after each sentence. You can think and then replay the video to see if you are answering right or wrong. So first question, fibromyalgia is a pure neurological disorder, right or wrong? Green or red? Actually, it is red. It is not a pure neurological disorder. Second question, fibromyalgia is a psychosomatic disorder. What is your opinion? Fibromyalgia is a psychosomatic disorder. Again, red. It is not a psychosomatic disorder, literally. Next. Fibromyalgia is an autoimmune disorder. What is your opinion? Actually, wrong. It is red. Fibromyalgia until now is not an autoimmune disorder. Next. The actual cause of fibromyalgia is not clear. The actual cause of fibromyalgia is not clear. Red or green? Of course, it is green. The actual cause is not clear. Next. Fibromyalgia is a medically serious disorder. Medically serious disorder. What is your opinion, right or wrong? Yes, it is a medically serious disorder, although many or most of the doctors consider fibromyalgia as medically simple disorder. It is not serious because it will not endanger life. For example, it will not cause handicap or organ damage, but it can interfere with the daily activities and even with the usual activities of the patient. Next. Fibromyalgia is more common among females. What is your opinion? Actually, it is nearly and exclusively female disease. So the answer is right. Fibromyalgia is more common among females. Next, fibromyalgia is underdiagnosed. What is your opinion? Yes, it is right. Fibromyalgia is underdiagnosed because it will not jump into your face, in front of your face, unless you think of it. There will never be any test to diagnose fibromyalgia or suggest fibromyalgia as one of the differential diagnoses. It is not, for example, like blood sugar, which may be done routinely and diagnose diabetes in unplanned diagnosis. So fibromyalgia is actually, it is surely underdiagnosed. But the opposite, fibromyalgia is overdiagnosed. What is your opinion? It is actually underdiagnosed. But is it overdiagnosed also? The answer here is also right. How? How it is under and overdiagnosed at the same time? It is underdiagnosed if you are not thinking of it, and it is mostly among non-rheumatology specialists. But it is overdiagnosed, especially among rheumatologists or some of the rheumatologists. If you are thinking of it all over the time, you may find that the diagnosis of fibromyalgia may be more simple than to exclude other differential diagnoses of similar cases. Next, tender points are mandatory for the diagnosis of fibromyalgia. Tender points, 11 out of 18 tender points, are mandatory for the diagnosis of fibromyalgia. Actually, it is now wrong because although the 1990 ACR classification criteria for fibromyalgia, although it includes the tender points, and here are the tender points as you remember. Although this, the new 2016 fibromyalgia classification criteria, the ACR 2016 revision of the 2010 ACR classification criteria, didn't include these tender points. So tender points are not mandatory for the diagnosis of fibromyalgia. Next, there is no treatment for fibromyalgia. There is no treatment. What is your opinion? Right or wrong? Green or red? Surprisingly, the answer is yellow because it is not right and not wrong. There are many treatments, but there is no efficient treatment for fibromyalgia, as you will see in the next slides. Usually, we have a dilemma for diagnosis and treatment of fibromyalgia. I, I can use nearly anything. Very few are agreed, but many treatments are tried for fibromyalgia, and none of them is actually curative or controlling the disease efficiently in the majority of cases. For example, these are some of the drugs or modalities used for management of fibromyalgia. As you see here, the agreement of these modalities regarding the American Pain Association, the Association of the Scientific Medical Society in Germany, the Canadian Pain Society, and the European League Against Rheumatism. Here are the four controlling or guiding agencies, and this is the modalities of treatment. Only few are strongly agreed by the majority of these organizations, but some are open, still open, or uh, uh, recommended for but not strong by the majority of the organizations. Not only these lines, but we have also these lines of management. You can stop here and read. I will save your time and will not read. Not only these, but also all of these are tried for the management of fibromyalgia. And finally, thank you very much for your attendance, and we will meet you in the next future with rheumatology capsules. Rheumatology capsules are small, short, less than 10 minutes videos regarding special entities of rheumatology. And hope you are benefited from these videos. Dr. Ahmad Rushdi Al-Ajami, Professor of Rheumatology, Sohag University, Egypt. Wassalamu alaikum wa rahmatullahi wa barakatuh.